Okay, guys, welcome back to our book club, Reading Between the Wines. We are on chapter 14, I believe. We're still talking about punishment. And now we're going to go on to possible side effects and problems with punishment, page 336. Okay, so they talk about emotional and aggressive reactions to punishment. Punishment, especially positive punishment in the form of aversive stimulation, may evoke aggressive behavior with respondent and operant components. For example, electric shock elicited reflexive forms of aggression and fighting in laboratory animals. So that seems pretty like human instinct in a way, right? Somebody's hurting you, you're gonna try to fight back. So those can be those emotional or aggressive reactions to punishment. Such pain elicited or respondent aggression is directed toward any nearby person or object. A student who is punished severely may begin to throw and destroy materials within her reach and attack other students or persons delivering the punishment. Aggressive behavior following punishment that occurs because it has enabled the person to escape an aversive situation in the past is referred to as operant aggression. So operant is learned, right? So that means that it's a learned behavior. So based off of a previous consequence that I had experienced of somebody beating me up, now my reflex or my reaction to that moment is going to be to fight back or to throw things at them or whatever the case may be. So they're calling that operant aggression. So basically, it's learned aggression in response to whatever positive punishment procedure was used on them. Okay, escape and avoidance are expected reactions to aversive stimulation. Escape and avoidance behavior take a wide variety of forms, some of which may be a greater problem than the target behavior being punished. For example, a student who is admonished repeatedly for sloppy work or coming to class unprepared may stop coming to class altogether. Okay, so because they keep coming into contact with this, I guess, aversive stimulus, they're like, well, then I'm just not going to go to school anymore because that's awful and I don't like the way it makes me feel. So that's basically what they're telling you, is that it can cause those escape and avoidant behaviors. Whereas like maybe that could have been avoided by using some type of reinforcement first to make the person want to engage in some type of behavior and feel that reinforcement at the same time so that they could continue to want to go to school. Okay, as the intensity of punishers increase, so too does the likelihood of escape and avoidance. So the more intense the shock is going to be, the harder I'm going to try to fight it or to get away, right? So that's what they're telling us, that the intensity will increase the likelihood of those escape and avoidant behaviors. And then they talk about behavioral contrast. Behavioral contrast is a word that you should know as a BCBA because it happens a lot. And it's important that you know how to explain it and what it is. So let's see, Reynolds, 1961, introduced the term behavioral contrast to refer to the phenomenon in which a change in one component of a multiple schedule that increases or decreases the rate of responding on that component is accompanied by a change in the response rate in the opposite direction on other unaltered components of the schedule. So that's just a very fancy Cooper-like way of saying that if they're being reinforced or punished for the behavior in one setting, then the opposite is going to happen in a different setting. So if I'm not able to do this here because I get punished, then I'm more likely to engage in it at home because they don't use the same type of consequence. Behavioral contrast can occur as a function of a change in reinforcement or punishment density on one component of a multiple schedule. Okay, let's see, the example that they give us for behavioral contrast for punishment takes the following general form. A, responses are occurring at similar rates on two components of a multiple schedule. Example, pigeon pecks at backlit key, which alternates between blue and green. Reinforcement is delivered on the same schedule on both keys, and the bird pecks at roughly the same rate regardless of the key's color. In situation B, responses on one component of the schedule are punished, whereas responses on the other component continue to go unpunished. So pecks on the blue key are punished and pecks on the green key continue to produce reinforcement at the prior rate. Rate of responding decreases on the punished component and increases on the unpunished component. So just being very careful with those suppression effects, that if we're suppressing it in one setting, then in the other setting, it's going to increase or decrease, vice versa, depending on what is going on in the two settings. Who can think of an example in like a clinical setting or in a school setting of a behavioral contrast for, I guess, a punishment procedure? So maybe it's being punished in one setting and not in the other.
So if like in the house, the parent takes the toy away, whereas like maybe in the school, or the computer away or laptop, whatever, and whereas in the school, they actually reward or maybe more time, kind of like the opposite.
More time on the computer.
Mm-hmm.
Yeah, kind of like a,
Yeah, so the behavior will increase in the setting where it's being reinforced and then decrease in the setting that it's being punished.
right.
And one thing that you learn in the ABA field is that like consistency is so important. So it doesn't make any sense if I'm doing this intense intervention in ABA, if he's just gonna go home and mom's gonna put him in a diaper for the rest of the day when we've been working on potty training all day or something like that. So it kind of, it's like you're fighting your own self. So it's really, really important that people understand what behavioral contrast is. And so like as a BCBA, as a supervisor, you might have to explain those type of things to parents so that they could understand how important ABA is and what you're doing. And that if they're not ready to do something or to go 100% with the intervention, then we'll wait until you are ready so that we can get the best outcome for your child.
Mm-hmm.
It's in a perfect world, right, Selena?
Yeah. Okay, punishment may involve modeling of undesired behavior. So that might be troublesome, right? Let's see the situation that they give us. Most readers are familiar with the example of a parent who, while spanking a child, says, "I will teach you not to hit your playmates." Unfortunately, the child may be more likely to imitate the parent's actions, not the parent's words. More than 3 decades of research have found a strong correlation between young children's exposure to harsh, excessive punishment, and antisocial behavior and conduct disorders in adolescents and adults. So basically, you're telling them not to hit their peers, but as a consequence, they're getting hit. So you're modeling the incorrect or the undesirable behavior. So that's not looking too good for you. Anyone attempting to control specific troublesome responses should avoid modeling punitive forms of behavior that do not counteract the effects of direct training, but also increase the probability that on future occasions, the individual may respond to interpersonal thwarting in an imitative manner. So that's something that I have kind of learned, is to like monitor my behavior and my reaction when it comes to my kids, right? Because I can ABA all day long and be like poker face, but when it comes to being a mom, it's like you turn into Godzilla. You're like, what?
Yeah.
You're like screaming. And so I've had to actually take a moment and be like, okay, hold on, like I'm over here screaming at her for lying to me. But I'm so scary, right? Because I get all like Godzilla on her whenever she does lie to me. So then she's scared to tell me the truth because she's afraid of my reaction. So it's like this vicious cycle of like negativity. So I'm like, okay, maybe I need to calm down and I need to react in a different way, so that she doesn't feel like she needs to lie to me because I'm not so scary and out of control. Basically, a reprimand or me screaming and going into Godzilla mode is punishing. So I'm adding that reprimand behavior. And so it's punishing her behavior of wanting to tell me the truth, or I don't know, whatever. So I always get myself in those moments where I'm like, I need to ABA my own self. But it's so hard as a mom. But at least it gives really good examples for tutoring and teaching you guys.
Definitely.
Okay, let's see. Punishment may be overused due to negative reinforcement of punishing agents' behavior. Oh, so that's another good one, right? So punishing them get negatively reinforced, right? They stop screaming or they stop doing whatever it is that they do because you
The Cooper book.
yelled at them or you spanked them, or whatever the case may be for that moment. And so it was actually reinforcing to you as the implementer or the interventionist. Sorry, my brain went sideways.
The interventionist.
What was I saying? Yes, I got distracted by the person that was not muted. Overdue. Okay, yes. So it becomes reinforcing to us. And so we continue to use that punishment behavior because it was quick and instant. And so that is also something that you should be on the lookout for ethically. It's like, okay, punishment is probably the easiest way, just because it's reinforcing to me, but are you really going about it the most ethical way? So maybe you could have used reinforcement first, but you were trying to get that negative reinforcement yourself quickly. So you just went the easy route. So that's one of those like ethical barriers for punishment as well.
What did we say last week about NCR again? I was trying to remember that. I'm like, oh, my head. Remember we were talking about NCR with the questions at the end?
Oh, non-contingent reinforcement means that you're reinforcing the behavior, or you're reinforcing on a non-contingent schedule. So you're trying not to get the behavior before or after it occurs, not while it's occurring.
Okay. Was that regarding punishment though, were they saying? I can't remember.
No, we were on something else, so we could talk about that one after.
Okay, I just came to my mind again. Okay, thank you.
Okay, positive punishment interventions. So here are some of the different interventions that you can use as a form of positive punishment. And so we all talk about reprimands, right? So yelling at somebody, no, stop it, don't do that. Those are punishment procedures. And I love teaching people about like how they can use reinforcement instead of punishment. So like instead of stop, no, don't do that. Instead, you can provide them with a teaching opportunity. So I'm just going to prompt them for the correct response. So like instead of saying stop, I'll say, hey, you can have your hands down. And then when they do put their hands down, you have an opportunity to reinforce. And so you're increasing the hands down behavior instead of just punishing them and not providing them with that teaching opportunity. So you got your reprimands as a form of positive punishment. You also have response blocking. As soon as they begin to emit the behavior to prevent the completion of the response, you are going to in some way block them. It has shown effectiveness in reducing the frequency of some problem behaviors, such as chronic mouthing, eye poking, and pica. So those are the ones where it's like, okay, these are a little bit more serious. And if I just block it, he'll eventually stop wanting to do it as much because it increases the response effort. So every time he has to go poke his eye, the BI blocks him. And so it makes it a whole new and more challenging process in a way. So that's why some people might use response blocking. In addition to prevention, the response from preventing the response from occurring by using the least amount of physical contact and restraint as possible, the therapist might issue a verbal reprimand or a prompt to stop engaging in the behavior. So that's good to know that just a verbal reprimand or telling them to stop can also be response blocking if it stops them from engaging in the behavior. Okay, and then you have RIRD. A lot of people probably know and study this one. It's a response interruption and redirection. So that one is kind of nice because you block and then you redirect them to something positive or something, a different behavior that you can reinforce. So out of those three, I would say we're getting somewhere that's a little bit nicer, probably a more ethical way to go. Two types of RIRD have been identified and evaluated in literature. So you have motor RIRD and then you have vocal RIRD. Both types have been used primarily with individuals with autism who emit high levels of repetitive, stereotypic, non-functional behaviors. So in this example, they, on the onset of stereotypic behavior, the therapist immediately presents a series of instructions or demands requiring high probability vocal or motor responses. What am I holding? Tell me your name, clap your hands. RIRD is usually terminated upon a certain criterion of successful responses, 3 correct in a row. RIRD has been used alone and combined with other procedures to reduce stereotypy so that students could engage in more interpersonal or socially appropriate behaviors. So you might want to try to do it in a little bit more natural way. So I wouldn't just like stop them and be like, what am I holding? Tell me your name, clap your hands. Maybe I would just like redirect them to do something else or to play with something else. So that might be a little bit nicer. But if you're trying to do like a very structured RIRD, it would be something like that, where you're making them or prompting them to engage in other behaviors that they cannot do at the same time as whatever it is you're trying to block. Okay, anybody have any examples of RIRD or a
Isn't it a DRA? So then wouldn't it be like a DRA alternative, like your,
yeah, it can be. It's like NCR, or no, not an NCR. High P, low P, behavior momentum type of thing.
Mm. Okay, how can you use RIRD for vocal stereotypy?
So like, let's say and that would be a good one to do it in a more natural way. So let's say they're like making a sound that's like non-functional and very high pitch, and they're supposed to be in class talking to their peers or something like that. So then you can block it by being like, hey, Peace, come over here. Tell me how your day was. And so now I'm making her engage in all of these conversations. And so I blocked that. I interrupted the stereotypy, and then I redirected her to engage in conversation with me. So that would be a more natural example of kind of blocking those stereotypic behaviors. Maybe it's non-functional, and then you redirect it to something more functional, which is like you talking to me or you playing with me, or us counting to 5, or something like that.
Okay,
Did that make sense, or did that help?
I think, yeah.
Yeah, so they're saying that you can use it for vocal or also for motor. So let's say they are doing I don't know, like banging on the table really loudly, and they're supposed to be reading a book or something like that. So you might block them from banging on the table by giving them a book, and you're like, hey, turn the page. And then he turns the page. Awesome job. What color is that? Oh, it is blue. Great job. And so you're just giving them those quick, really easy directions that block the inappropriate behavior. Okay, hold on, guys. I'm going to pause the recording.